Hello everyone, I am Dr. Manoj Bachhav, Plastic and Cosmetic Surgeon at Elite Cosmetic Surgery Center, Nasik, Maharashtra. Today we are going to discuss about breast augmentation using breast implants or fat grafting. This is one of the topic which was quite tabooed or less talked few years back in India at least, but nowadays it is quite common. People are talking about it. We are believe me, we are getting quite frequent inquiries about it. Females are getting it done and they are getting very good results also. So today we are going to talk about breast augmentation. What does it mean by breast augmentation? What are the options of increasing the size, that is the breast? What are the options for breast augmentation? And then we will discuss each method in detail. What are the results we are expecting? There are some myths regarding breast implant that also needs to be busted. So what is the post-operative care you need to take, how long the breast implants stay, etc, etc. So we'll start with what is meaning by breast augmentation. Breast augmentation or breast enhancement, we can call it, is simply increasing the volume of the breast. So to increase the volume of the breast, we have there are many methods, but two most commonly used methods are fat grafting, that is taking the fat from your own body and injecting into it, and second method that is most commonly used is breast implant. So basically, before going ahead with the procedure, we will talk about the indications of the surgery or the procedure, and then we will see each method in detail. So basically, breast augmentation is done for small size breast. If the volume is less, then it can be done. Then it can be done for small volume also for the sagging of the breast. Many a times there, after pregnancy and breastfeeding, the breast volume is reduced and the breast sag down, or we call it ptosis. So to some extent with the implant, the ptosis is also corrected, that is breast is uplifted also along with increasing the volume. Now there are conditions when there is volume is sufficient, there is only sagging of the breast, that is ptosis. So that can be simply corrected with mastopexy. That means just upliftment of the breast. We don't need to put in volume, we don't need breast implant, or we don't need fat, we just need upliftment of the breast. The procedure is called as mastopexy. So this is a different category of the patients who have good volume and only ptosis. So basically we need to evaluate what is the volume of the breast. Each case needs to be evaluated. We take the measurements and then we can decide what method can be suited for you. So first method of augmentation, that is fat grafting, that we will discuss. So fat grafting is basically we take out the excess amount of fat from either lower abdomen or the thighs or the flanks where it is in excess. So you get benefited of body sculpting for liposuction also, using liposuction procedure kind of. So you get benefits of reducing the fat from the sides where it is in excess, and we centrifuge it, and then we will inject it into the breast. So this is called as fat grafting for breast augmentation. So one way the benefits of fat grafting are that it is basically your own body tissue. So you don't get foreign body. We don't need to put any foreign body in the body, so there are no reactions to it. So that is the biggest advantage with the fat grafting. It is usually done under general anesthesia, so quite painless procedure, daycare procedure. But the only downside or the limitation of fat grafting is that we cannot put very high amount of fat in the breast, because it can cause the sinus formation and necrosis of the fat. So only those patients who require only small to moderate amount of augmentation are suited for this procedure. If the volume requirement is quite good, moderate to high amount of volume is required, then we need to go ahead with the breast implants. So this is regarding the fat grafting. Now we'll see how we do the breast implant surgery. Basically, before going ahead with the breast implant surgery, we need to finalize the size of the type and size of the implant. And the patient is evaluated. There are various parameters that are measured, that is breast height, breast width, skin fold thickness, your body texture is also taken into consideration. Also, the patient's expectation are taken into consideration before finalizing the size of the implant. Then we can Once all this is discussed, then we can finalize the volume of the implant, the width of the implant, the base, the height, and the projection of the implant. So once everything is finalized, then we can go ahead with the surgery. Now this surgery is done under general anesthesia, so it is again a painless procedure. It is done under daycare procedure. Takes around 1.5 to 2 hours maximum to get it done. Once the patient is admitted in the morning, evening she can go back home. There is a small around 4.5 to 5 centimeter linear incision in the inframammary fold that is below the breast, that is in the hidden skin crease, and the sutures taken are absorbable sutures, so we don't need to remove it again. And the scar is not visible in the post-operative or later on, even in the front profile or the lateral side also. So this is just 1.5 or 2 hour thing with a daycare, in a daycare setup, that is morning and evening again patient can go home. Post-operatively you need to wear supportive garments that are advised by us. Many people have the myth that do we need to change it every 5 to 10 years or so. So it is not like that. Once we put it, it is for the lifetime. We don't need to remove it unless and until after some time you feel that I want further projection or larger size, then we can take it out simply and we can put a different size or higher size implant in that case. So this is regarding the breast implant surgery, which was quite less talked, or I'll say taboo topics few years back, but definitely it is being done by us quite frequently. People are getting it done, but they don't still talk about it much even if with their friends. But I will just like to say that it is not only the cosmetic thing, it will boost the morale and the confidence of the female to quite a large extent, because the reduced size and the ptosis, the sagging of the breast is quite haunting for a female, and with this simple procedure it can definitely change the drastic changes in the appearance and also help in boosting the confidence. So I hope we have covered majority of the queries regarding breast implant. If you have further queries, you can